So my idea for a smart, switchable, and pain-free adhesive started about 8 years ago, after I had sold my medical practice. Looking back at the time, a family member, a close family member, was being treated for chemotherapy for cancer. I'm happy to report that their battle was a successful one, as they are cancer-free today. Yet looking back at the time, one of the biggest hurdles they had to overcome actually came just as they were ending their cancer treatment. They experienced a severe skin tear as a nurse was removing an IV securement device. The skin tear turned into an infected wound, and that infected wound required an extended hospital stay for 4 weeks. I knew that this complication was unnecessary. I knew from my own medical practice that many patients suffered from skin injuries, from medical dressing removal, and my own children actually hated the discomfort of simply removing common adhesive bandages or tapes. And most of those Band-Aids didn't stay on as long as we needed them to. We needed to invent a smart adhesive dressing that goes on when you need it to, it has optimal adhesion, yet can be removed on command with no pain, no trauma, no residue, and no skin tear. And particularly when the patient's ready to go home or in a hospital. I've later learned that an estimated 1.5 to 4.5 million documented skin tears related to removal of bandages, tapes, and dressings occur every year in the United States. I also learned that nurses sometimes take 15 minutes to gently remove a bandage or a dressing from a patient because of the associated pain or potential injury that it causes. It seems like most medical bandage companies simply do not care. With my engineering background, I was able to work on the development with a young Dr. Professor Wang in the biomedical engineering department at Georgia Tech. Dr. Wang is now a full professor of biomedical engineering at Cornell University. Together, Dr. Wang and I developed the world's first smart, switchable adhesive for bandages, tapes, and dressings, backed by multiple patents. The secret sauce that we created is an adhesive made of a polymer that functions almost like a light switch. When it is on, it provides optimal adhesion combined with highly breathable properties, leading to greater comfort, extended wear time for patients both in the hospital and at home. The breathable dressings benefit from high measured moisture vapor transmission rate value, an MVTR. This is a measurement of breathability, and it's unsurpassed by any other product on the market. But when it's time for removal, the polymer can be turned off. The adhesive bond drops off with a small swipe of rubbing alcohol or isopropyl alcohol around the border of the dressing, around the border of the bandage or tape. Today, we're ready to improve the standard of care to protect sensitive skin with our branded Comfort Release portfolio of smart, pain-free adhesive products, which are ideal for geriatric, pediatric, and any other patient with thin skin, such as someone on blood thinners, steroids, or other medications. We can now avert medical adverse events like skin injuries and skin tears, and it really helps everyone in the healthcare industry, but especially the patient. And that's really the basis for Comfort Release technology. And that's why we came up with the concept of a smart, switchable coverage used in products such as bandages, tapes and dressings, and securement products for wound prevention and management. And we're proud to say today that we're able to do just that.